Hello everyone, welcome to Bone Biopsy. So I am Dr. Pranjal Agrawal, your orthopedic surgeon. So today we are going to discuss about clavicle fracture. We had already discussed about the normal shoulder anatomy or normal shoulder X-ray in our previous video. So starting with the pathology of shoulder, we are going to discuss about clavicle fracture. So first of all, we should know what is the normal anatomy and how the bone looks like. So it is a as once again, it is a S-shaped bone and a flat bone, S-shaped flat bone. So what are the attachments? This is the superior surface, this is the inferior surface of the clavicle, and this is the medial end of the clavicle and this is the lateral end of the clavicle. So over the medial end there is attachment of sternocleidomastoid, there is attachment of pectoralis major, and there is attachment of deltoid and trapezius over the lateral aspect. Now coming to the inferior surface, what is important over the inferior surface is the ligament. This is coracoclavicular ligament. This coracoclavicular ligament has two parts. First is trapezoid and another one is conoid. So as you can see in this diagram, this is the conoid and this is trapezoid. Trapezoid is more lateral as compared to the conoid ligament. So you can see this is the normal anatomy. This is clavicle, this is the acromion, this is scapula, this is the coracoid process, this is humerus. And what is important in this diagram is this conoid ligament and another one is trapezoid ligament. Coming to the X-ray of fracture clavicle. So first of all, we should know what is the normal incidences in our country. It is around 2 to 4% of adult population, and around 70% of the fractures are from the mid shaft or the middle 1/3. Coming to this X-ray, as we had already discussed that this is an AP view of let's assume this is the left shoulder X-ray. This part is the clavicle, this is clavicle which is fractured from the mid 1/3. Okay, this is the acromion part, this is humerus, this is coracoid process. There may be some ligament which are attached here. This is trapezoid, this is conoid. Okay, this is conoid and this is trapezoid. So as you can see in this X-ray, there is proximal migration of the, as you can see in this X-ray, this proximal fragment of the clavicle goes superiorly and the distal fragment goes inferiorly. तो ये कैसे possible है? यहाँ पे sternocleidomastoid का attachment था. Due to the pull of this muscle, this fragment goes superiorly, and due to the pull of gravity, gravitational force, this fragment goes distally. Okay, so this is the basic anatomy and basic principle of the displacement. Now coming to the classification of the clavicle fracture. So we are going to discuss about two main classification. One is Allman classification, another one is Neers classification. So first of all, we will discuss about Allman's classification. Suppose this is a clavicle, just divide it into three parts. One, this is the first part, this is the second part, and the middle one is the third part. So the Allman classification classifies the fracture of clavicle into three groups: group 1, group 2 and group 3. जैसा कि हमें पता है मोस्ट कॉमन जो होता है वो मिडिल 1/3 से होता है, तो ग्रुप 1 में मिड 1/3 वाले जो भी फ्रैक्चर्स होंगे वो ग्रुप 1 में आ जाएंगे। ग्रुप 2 में क्या होगा, लैटरल साइड में जो भी फ्रैक्चर्स होंगे वो ग्रुप 2 में आ जाएंगे, लैटरल एंड ऑफ क्लैविकल, एंड अगर मीडियल साइड में हो रहा है तो वो ग्रुप 3 में आ जाएंगे, मोर कॉमन टू लेस कॉमन। ओके, दिस इज ऑलमैन क्लासिफिकेशन, दिस इज सिंपल। अब इसी का मॉडिफिकेशन नीड्स क्लासिफिकेशन बनाया, उसमें क्या है, ग्रुप 2 को बस हमने डिवाइड कर दिया 3 पार्ट में, 3 सब ग्रुप्स में। वो क्या क्या है आप फोटो में देखो, इस वाले इसमें देखो, देखो ये ग्रुप 1 है, मिड 1/3 फ्रैक्चर, दिस फ्रैक्चर इज लैटरल 1/3 फ्रैक्चर और लैटरल एंड ऑफ द क्लैविकल फ्रैक्चर। So this is group 2, and this group 2 is further divided into 3 subtypes. First one is the fracture just medial to the conoid ligament. So the conoid ligament and trapezoid ligament is intact. Okay. Another B subtype is this fracture is between or lateral to the conoid ligament but medial to the trapezoid ligament. So the trapezoid ligament is intact but the conoid ligament is gone. Okay, as you can see in this photograph. Now the fracture is more lateral or it comes to the AC joint, and this is the group 3, the fracture in the medial part of the clavicle. Okay, now what is the management? Coming to the management, first of all we can go with the conservative management, and we will discuss about the indications of the operative management also. In the conservative management we can go with this type of brace. What is this brace called as? The clavicular brace. So it depresses, one second, suppose this is the displacement of the clavicle. So what is this doing? This pushes the proximal fragment distally, so the fracture is more reduced, or this brace is called as clavicular brace. Now coming to the indications of the for operative management. So the first indication is carminated fracture of clavicle. Another one is lateral end fractures. Lateral end fractures should be fixed operatively. Another one is if there is shortening of more than 2 centimeter, if it ruptures the platysma muscle, then we have to go with the operative management. Now coming to the operative management of the diaphyseal fractures or the mid 1/3 fractures. So first of all you can go with this type of nail. This nail is inserted from the lateral end, and this nail is known as tense nail. Okay, or you can go with the K wire, but it provides more elasticity, so we can go with the tense nail. Another is pre-contoured plates for the clavicle. So this is the S-shaped plate. The fracture is reduced, and this plate is applied over the superior surface of the clavicle. So आपको क्या ध्यान रखना है जब आप ऑपरेट करेंगे? तो एक नर्व होती है, जब आप डिसेक्शन करके ले जाएंगे, हमने सुपीरियरली एक इंसिजन लगाया, जब हम डिसेक्ट कर रहे होंगे तो हमें ये नर्व दिखेगी। इन दोनों फोटोग्राफ में आप देख सकते हैं, ये होती है सुप्रास्कैपुलर नर्व. दिस नर्व इज सुप्रास्कैपुलर नर्व. ठीक है, तो ये देखनी है हमें, बचानी है, कोशिश करनी है. ये ऐसे दिखेगी, मल्टीपल इसमें ब्रांचेज होंगी सुप्रास्कैपुलर नर्व की, तो इसको हमें बचाने की कोशिश करनी है डिसेक्शन में. नाउ कमिंग टू lateral end of clavicle, the management of lateral end of clavicle. So this is tension-band wiring of the lateral end clavicle. Another one is this plate is known as hook plate. Okay, so this is hook plate. We can apply this for lateral end of clavicle. So this is all for this video. In the next video we will discuss another pathology of shoulder joint. So thank you for watching. Please subscribe our channel for more videos.